This is Andrew Kramer bringing you another penile implant. This is a younger man that just lived long enough with ED that he didn't want to live like that anymore. And he already knew that, as we get older, it can only get worse. And he's tried everything. Pills, they might have worked somewhat, but again, is that sustainable? Do you want to do that all the time? Do you want to scar the penis? And also, spontaneity is a challenge. So the penile implant was a decision. He's going to have a lot of veins in his scrotum and penis, and that's the challenge. I'm not going to show every single vein that we tied off or cauterized, but it was like a landmine, as you see right there, huge vein. So, and the pearly white, that whole landing strip of white corpora, see, you don't see it. Everything's sort of covered in veins. We do find just a little window that we can get those cylinders into, holding stitches in. We do them at the same time, my assistant and I in this case, as you see that left and right. And then once we have both sides, we're going to measure and dilate. So he's going to have blood outside the corpora. He's going to have blood, a lot of blood inside the corpora. So that's just the challenge. We're trained for that. We're used to it. But a goal is to see perfectly so that you can fire off that perfect cylinder every time. And anything that gets in the way of that can make it tough. So reservoir there in the left, no trouble at all. Sometimes young guys are thick muscles and you can't get a reservoir in so easily, but he is okay. And fortunately, no veins in that area because they're hard to control. So now, last thing we have to do after we fill the reservoir there is put in those cylinders and test it. And I think he felt he had lost size, and that's possible because when you have ED for years, it's a muscle. It's a use it or lose it type of muscle. So he did not want to wait to get the implant in. On the other hand, I think he's got a good result in terms of length. He's exactly 21 centimeters, which is nice because that means you can fit the implant with no rear tip extenders at all. He's got all implant, no tips. One choice would be an 18 plus 3, but I would never make that choice. I would always go the other way, 21 and no tips, and just make the pump go where you want it to go, which you can do by, in this case, using an infrapubic kit scrotally. That gets the pump low, do the splice, and then I'm ready to test it. And you'll see how good that result is just now. So pumping it up, tips are all the way up. Maybe a little fibrosis when I was sort of getting my tip dissection and measurements, but I think now as a finished product, the tips are all the way up. I'm thrilled about that, as will he be. So again, make sure the bleeding is stopped. That was really the challenge. And fortunately, at this point, we did control all the bleeding. Remember, you got to do a watertight closure of the corpora, and your dissection has to be spot on. And you got to be careful with both reservoir and pump. Those are areas people overlook with bleeding and hematomas, and I don't overlook them. I make sure those are clean and dry. As you see, no bleeding at this point at all, and dissolvable stitches, just a little scrotal scratch almost. All it'll be right along the midline raphe. Andrew Kramer, Urology Associates, Cape Cod. Thank you so much.